In this slide, I will discuss a fishbone diagram, which helps to ask the why questions behind the problem, which in this case is patient falls. So all the way to the left, we have people who are involved, and those include nurses who are unable to answer the virtual sitter call outs quickly enough to reach the patient before the patient falls. And then nurse aides, there are often not enough nurse aides to help nurses answer the call outs quickly enough. Process fall risk assessment, which at times is inadequate and doesn't accurately assess the patient's risk of fall. And then methods of determining if a patient needs a virtual sitter or an in-person sitter. As far as equipment, the virtual sitter monitors equipment in this situation, which allows a patient to be continually monitored but doesn't have the response time of an in-person sitter. The environment in this case is how far the nurses have to travel to get to the patient once the virtual sitter makes the call that the patient's trying to get up. And then management. Management determines who qualifies for a sitter, and then they are also responsible for managing the cost of in-person sitters or virtual sitters, and then also staffing. And then regulation, there are financial restraints involved.